This video is made possible by our loyal Patreon supporters. Visit patreon.com/PsycheTruth.
Hi, welcome. Today I'm going to be working on Julia, and we're going to be doing massage for headaches. So this is going to be a quicker massage, just some tips if you don't have a whole lot of time. So I'm going to go ahead and dive right in. And to get started, I'm actually not going to use any oil. So if somebody's complaining of headaches, I immediately think of the occipital muscle, suboccipitals, and the frontalis. So kind of the best way I found to start is with some scalp. So my hands don't have any oil, which is nice. And whenever I go in, around the face or with scalp, you want to make sure that's okay with your client, especially if their makeup looks perfect. It's the middle of the day. So the frontalis and occipitalis muscles kind of follow each other's lead. So when I can really just encourage this frontalis muscle to soften and let go of tension, it has this ripple effect on the occipital and suboccipital muscles. And sometimes I'll work the other way around, where I'll work on the frontalis later, but it just kind of depends on my client. And if you're crossing the hairline, you're definitely on the frontalis muscle. Just kind of going back and forth. You can do little circles if you want. I really like this technique. I just feel most comfortable with it. And if I don't have a lot of time, I'm always asking myself how I can work most efficiently. And so if I can get this frontalis muscle to soften a little bit, I'm going to have an easier time along that occipital ridge usually. And I always kind of check in with the temples. You can create a lot of softness in this muscle just by massaging this area as well. And I'm going to go ahead and just turn the head a little bit, and I'm going to work my way around the side of the head and into that occipital area a little bit more. Sometimes if someone comes in with a migraine or a headache, they don't want more pain. So if you can find ways to help things along without doing deep tissue, sometimes it's more effective. If you can just stimulate things in the right way, you don't have to use deep tissue to help things along. And I always angle my chair so that my wrist is at a comfortable angle when I'm working, as I kind of shift things. And always including that mastoid process. Some really important attachments in there. And there's all kinds of techniques that you can use to stimulate the occipitalis. So I'm going to cover a nice broad surface area. And just making sure that Julia's head is supported with my opposite hand. One of the most simple things you can do for your client if they're having issues with headaches, remind them to relax their jaw and just let the tongue rest in the lower part of their mouth. Just creating space that immediately relieves a ton of tension on the frontalis muscle without them even thinking about it. And indirectly, it helps these other muscles as well. And I'm going to go in to these occipitals, and I'm just going to do some compressions. And if at any point, as I introduce a little bit more pressure, if I kind of feel anything fight back, it's a sign that I need to adjust my pressure, communicate with my client. If you're working on someone new or you're trying out a new technique with someone you've worked on, communication is really important. So I know when I was first starting to do massage, it felt really awkward to try and communicate in the middle of a massage, but it's not. It just helps everyone feel more comfortable. I like to go back and forth between the suboccipitals and the occipitalis. So kind of just encourage everything to soften. And I'm going to do that same routine on this opposite side. When you're working on these muscles, it's really important that you're firm in your touch. If you're, you don't want to go in too soft or too hard. Just finding that balance. And just little things. Whenever I'm doing this kind of work, I make sure that I can rest my wrists on the table, because if they're floating, it's going to be a lot more work for me. It's going to be a lot harder. And before I forget, I want to thank a few of our patrons. I'd like to thank Andrew Cook, Jaquette White, and John Thompson. Thank you guys so much for your support. I would say if you only have a few minutes at the end of a massage to do work for headaches, just working on that frontalis muscle is like one of the best things you can do. I like to, if I'm wrapping up a side, I really like to end with something more relaxed and less focused. It just usually feels better. And I'd like to spend a little bit more time just really on something that feels really good. This is also if you are new to massage and you aren't sure what you're doing, this is really hard to mess up. So just anything you do around here is going to feel really nice. If you really want to spoil your client, this is one of my favorite moves for people with headaches. So I'll wrap my hands around the ears and I'll kind of drag my hands up. I'll do this for most people that have issues with headaches. And just find a pace that works for you. There's no right or wrong. Just kind of read your client too. And that is all for today. Thank you for joining us today, guys. I enjoyed spending this time with you. If you enjoyed today's video, you should check out our Patreon page where you'll find some exclusive content. I look forward to seeing you there.